So for today, our first speaker will be Ma'am from USA, Ambassador Jeannie Rapstad. And she will be sharing with us on prevention of health issue. But before I put her on, may I quickly share her profile. Ambassador Janet is, I don't know how that one gets there. Sorry about that. Award-winning international speaker, award-winning writer, educationist, academic journal editor, speaker and pitch coach, seminar presenter, entrepreneur with international business experience, working actress and comedian. October 2022 to present, instructors, Houghton University, Northwest Commercialization and Manufacturing Excellence Center, Agmunod, India. Contract control for putting CMEC Pitch Masters Workshop for student and adult entrepreneur. Okay, he's also the Chipaco International India/UK Core Team Tenacity Country Ambassador for the USA. Also 2024 Weekly Contributor for CCE SCS Podcast Broadcast by Edutainment Spoken English and Smart Classes in India. And also in 2024, Metamorphosis Education Change Maker for Metamorphosis in India. So many, many more. But if I go on, we will spend all days telling you about Ambassador Jeannie Rapstad. But I believe you can read, so I will still continue showing the slides. Okay, so this will be the last one. Let's welcome Ma'am Ambassador Jeannie Rapstad from USA. Bear in mind, it might be around 2 a.m. in the morning in USA, but she's committed. She's also our president, YYCI president in USA. So you can see our commitment, our sacrifice, and we appreciate that, ma'am. Thank you so much for joining us today. I follow your leadership by wearing cream and red today from your picture on the flyer. So this is just for you, ma'am. But I didn't put on any cap. So God bless you. You're welcome.
Thank you so much for that wonderful introduction. And you always make me feel so welcome and warm, and I appreciate that very much. I have prepared a program about prevention of health issues,
Yes, ma'am.
and I have, I'd like to
Slides.
share my screen, please.
Okay.
I'm going to go here.
Yes, I'm going to do that straight away, ma'am.
Okay.
Yes, I've done it. Actually, I'm going to. Yes, you can share your screen, ma'am.
Okay, and now I'm going to go here, and let's go back up here. I'm sharing my screen, and now I want to do the slideshow from the beginning. Okay. All right. So I am not a doctor or a registered nurse or any kind of healthcare professional, but I am an educated layperson who has spent a lot of time educating myself about health issues because I was a caregiver for my mother for 5 years. And I grew up in a household where one of my brothers was handicapped and disabled. So we had a lot of challenges dealing with those issues in our family. So I've put together a program, but since I have reached the age now where I am dealing with health issues and having to make good decisions. So, once again, thank you very much for inviting me here, and I'd like to start my show. Okay, so to prevent health issues, we have to take care of our bodies. That's just a fact. If we are abusing alcohol, if we are abusing drugs, if we are overeating, if we don't ever exercise, if we are allowing our mental health to deteriorate due to depression and loneliness and other factors, then we are not going to be a healthy entity anymore. This is just a fact because the law of cause and effect is very strict. And as you age, all of those uh, mistreatments of your holy vessel are going to come home to roost and you're going to have health issues. So I just like to uh, state this very clearly to all of our young people. Try to be as healthy as you can because at some point in your life, excess smoking, uh, alcohol, drugs, obesity, you're going to become ill. So, healthy mind, body, and spirit. These are the issues I'm going to talk about today from head to toe. So, when we have a healthy mind, we have a beautiful smile, as this lady does in the first picture. And when we have a healthy body, we are exercising it, as this couple is doing in the center photo. And we have a spirituality about us, whether it's through our religious practices or studies that we do, maybe reading scripture. I've been a practicing Buddhist since March of 1984. I have prayers twice a day, morning and evening. And I am a prayerful woman and I maintain my spirituality through that. One way that we can prevent health issues is by having health screenings, like an annual physical, an eye examination, such as what is happening in the photo here, mammograms, colonoscopies, dental examinations, because as we just talked about briefly, healthy mind, body, and spirit. So we have to have uh, these monitors to see how our body is doing. So, are we healthy emotionally, psychologically, and socially? How do we feel and act? Is everything working as it should be together? Are we maintaining our bodies in good nutrition? And the annual physicals will tell us that. Regular exercises will show us that our heart is doing well and that our respiratory system is doing well. And if we are avoiding the harmful habits that I just talked about, we will maintain our healthy body. And then our spiritual health will show in whatever practice we're doing to maintain that. So I'd like to talk about how to develop the account financially to address these annual screenings. So if you have health insurance, you're very fortunate. Some people don't have health insurance here, even here in the United States. We do not have health insurance, universal health insurance for everybody. We have actually four different systems. We have a system for the veterans, which is kind of similar to the socialist system. And we have the system that's through private insurers that many of us who are working, we pay a premium, the employer pays a premium, and we have health insurance. And that is basically the best kind of insurance because you are covered for everything. And then we have Medicaid for people who are don't have enough money to buy health insurance privately, so they get a reduced rate. The problem with that is that it's hard to find a physician who's willing to take on a Medicaid patient because there's only so many hours in the day and they would rather fill them with people that can pay full price. And then we have the Medicare system, which is like, the national agency that takes care of senior citizens. So many people are left to pay for health care out of pocket, and that is an expensive way to go. So, if you don't have health insurance, you need to create a savings account. because you cannot permit yourself to not have any kind of financial backup should you injure yourself, become seriously ill, or even a minor illness which takes you to the doctor. And if you have insurance, then you may need to pay for annual deductibles or copays. So you have to create a savings account that's going to cover your needs. If you live in a country that offers universal health care, then you don't probably have to worry too much about a private account, although it's always a good idea to have backup money. But you cannot neglect this budget item. I have met people in my life who spend money on frivolous things, but they don't put aside any money for their health care or for the health care of their children. Now, when we become adults, we have to act responsibly. That is not an option. We have to look after our families, and that's just the way of the world. Now, this is something I learned when I was a child. Be true to your teeth, or they will be false to you. Did everybody learn that when you were a child? We laugh about it here in the United States, but it's absolutely true. We have to maintain the health of our mouth, our teeth, our gums. Otherwise, we can have real problems. We can have serious issues that cause us to lose our teeth or our teeth become rotten. So, dental health means to brush your teeth at least twice a day with a fluoride toothpaste. Clean between your teeth by flossing. Aim for at least once a day. I do it twice a day or sometimes more if I eat something that's fibrous and gets stuck in my teeth. Visit the dentist for routine checkups at least once a year. Drink fluorinated water. Most cities in America have a fluoride into the water system. Don't smoke. Smoking causes a lot of problems with your mouth, your teeth, your gums, your tongue. So if you can possibly avoid starting to smoke or chewing tobacco, don't do it. In the end, you're going to have to pay the price for it. And if you are planning to become pregnant, have a dental checkup because we know that the fetus takes calcium from the mother's body. So let's make sure that her teeth are strong and that she may need vitamins. Uh, Eat a well balanced diet because, like anything else, a well balanced diet keeps your mouth strong. I'm going to go to my next slide. Excuse me. I'm sorry, I have a little frog in my throat here. So, good posture is important for overall health. I mean, this is really, really important because you can avoid many common ailments and medical conditions by just making sure that the force of gravity throughout your body is in proper alignment. You can reduce strain on your muscles and ligaments, and you can move more efficiently if you have proper posture. Good posture can also help you avoid injuries, especially when you're exercising or working in your yard or doing something strenuous. If you have the right posture, you're more likely to be protecting your body all the way out. And you can reduce wear and tear on your joints, especially in your spine. Another thing that we are to be concerned about is, especially if we spend a lot of time at the computer, is that we don't maintain good posture while we're working and we begin to start slumping down and eventually we start having backaches. Perhaps we need to get special seat units for our chairs that are ergonomically designed to help us stay upright and in a good posture situation. So I would really encourage you, if you begin to notice that your posture is failing, to start doing some exercises. There are many that are online. You can go to YouTube, and search for exercises for good posture. And there are many, many of them out there. And I've looked at them and they're very, very good and helpful. And if I were you, I would look at them. I'm going to go to my next slide. I'm going to talk a little bit about obesity. It is a problem here in the United States. Many, many people are, excuse me, have allowed themselves to get obese, and that causes a lot of health problems.
Do you want to drink water?
I don't have any here, but I would like to turn off my mute for a minute. I'm sorry.
Yes, please.
Right now, I'm sorry about this. It's just
No, it's okay.
happened.
It's okay, Mom. It's okay.
Okay,
Okay,
ma'am. Okay, okay.
thank you. Um, Obesity can cause cardiovascular disease. This is a very, very common. High blood pressure, unhealthy cholesterol levels, and those are risk factors for heart disease and stroke. High blood pressure is also the leading cause of stroke. So we should think about that before we allow ourselves to get, too heavy in weight. Diabetes, that's one of the diseases that we deal with a lot here in the United States. Many dialysis centers are popping up in my town because so many people are obese. They're having renal failure. They're having to uh, uh, attend to dialysis 3, 4 times a week. This is not any kind of way to live, and we should just prevent it. Obesity can affect how the body uses insulin to control blood sugar levels, which can lead to type 2 diabetes, and many people have that. Cancer is also resultant from obesity, and this includes breast cancer, colon cancer, and endometrial cancer are a result, the studies show, from obesity. And then musculoskeletal disorders due to carrying excess weight and how it affects pressure on our joints. Um, Obesity can lead to osteoarthritis. It can cause breathing problems like sleep apnea and asthma. And there are other conditions which I have shown on here: gallbladder disease, hypertension, and depression. So, the best thing to do is to maintain a healthy weight so that you don't have this. As I talked about earlier, cause and effect is very strict. If you abuse your body, eventually you are going to have to pay the price. So, what we want to do is make healthy food choices. My mother used to say when we were kids and we were, gobbling up snacks that we didn't really need, she said, "You eat to live, you don't live to eat." And I've always remembered that because it's important to maintain a healthy diet. And here in the United States, we eat a lot of fast food, which is high in fat and calories, and empty calories at that. So, what we want to try to do is when we create our meal plans, morning, for breakfast, lunch, and dinner, that we are thoughtful and what we have decided that we are going to put in our bodies that day. And so here on the chart, you see grains, vegetables, fruits, proteins, and dairy. And we should try to take a healthy selection from each one of those groups on a daily basis. And now, one of the things that a lot of people don't do, or at least my friends don't do it, they're not very fond of nuts. And I've always been very fond of nuts. But when I found out how good they are for the body, I said, well, I'm going to continue this habit of eating nuts. And I love all of the ones that are listed on this particular chart. And you see that they have special uh, fatty acids that benefit the bones. They have uh, you know, enzymes and nutrients that increase selenium levels. They can work for cardiovascular health and uh, help you avoid some diabetes risks. Almonds are one of my favorite nuts. I eat them every day. Cashews are high in unsaturated fats and dietary fiber and plant-based protein. And pecans is another one of my favorite nuts. I have some right here in my fridge today. They help lower cholesterol levels and they're an antioxidant. So, nuts are a very healthy snack and probably a lot better for you than eating a bag of potato chips or corn chips or something else that's basically, fat and starch. These are some fruits that can help you fight diabetes if you are on the cusp, like pre-diabetic. These are the fruits that they are teaching us are the best to use because they have fiber and they help adjust blood sugar levels, and they help promote weight loss and have vitamins that are really necessary in helping us fight type 2 diabetes, which is a very prevalent disease here in the United States. So what we want to do is choose foods that heal your body and lift your moods. And here is another wonderful chart that I came across showing the kinds of foods that heal various things like diabetes, ulcers, asthma, high blood pressure, arthritis, kidney detox, kidney stones, eyes, stress, constipation, and fatigue. And whenever our body is, out of sync with each other, we maybe develop something like stress, or we get fatigue, or our blood pressure goes up, or we feel a little constipated. So we can go and find food that will help us. And you may notice by looking at this chart that carrots are very good for so many healthy reasons. And I eat carrots. I have carrot sticks in my fridge all the time, so I can just pop open my container, and I wash them and slice them up, and they're a ready snack right there. And they're so good for everything. And they're not expensive. So I would recommend carrots in your diet if you don't eat them already. They're very good for you. Now, you can cheat sparingly, and I've got a little bit of humor in here for you, because whenever I cheat, these are the things I cheat with: milkshakes and French fries. And I have a very good reason for that. If I can find my piece of paper here. Okay, so I come from a Norwegian background, but I also have Irish and French in me. And this is my reasoning for eating French fries, which everybody over here says, don't eat them. They're not good for you, blah, 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 blah. Okay, but this is my rationale. Sir Walter Raleigh, who was an Englishman, introduced potatoes into Ireland in 1589. And the Irish, my ancestors, have lived on potatoes ever since. French fries were first mentioned in 1775 in a Parisian cookbook. The very first recipe for modern French fries was found in the French cookbook La Cuisinière Républicaine in 1795. So I've got my Irish ancestors eating potatoes and my French ancestors frying them up into French fries. I feel it is my duty, my filial duty, to eat French fries. Okay, enough said. All right, now, some other things that we can do to prevent disease. We can protect our eyes, ears, and lungs while doing yard work or home improvement projects. So what I have here are some goggles to protect the eyes from, let's say you're doing a project where you're creating a sawdust because you're sanding something down to refinish it, or you're mowing the lawn and there's a lot of dust and dirt revved up by your mower. You may want to wear goggles. And if your mower is extremely loud, you may want to use noise canceling headphones. And masks if you have particles that are in the immediate air that you're breathing because you're working on a home improvement project, and you may want to wear a mask. And these are good because everything that you inhale then goes into your nasal system, your membranes, and lodges in the bronchial tubes. And there is no point in inhaling uh, dust and dirt that you don't need to, or sawdust. You don't need to do that. So, and these items here can be found in any hardware store. All of these I chose off of Amazon.com. They're all very affordable. And so I recommend investing in those if you are a do-it-yourself project person, or if you do yard work. These are things that can be very helpful to you and maintain your hearing and protect your eyes. Now, I've gotten to the age now where I have to be really pay attention to trying to avoid falling. Especially, I live in a house where I'm up and down the stairs 30 times a day. I like to carry things up and down the stairs, and I'm finding that I maybe shouldn't really be doing that. I should making two trips, or instead of carrying things in my arms, carrying them in a bag. So one hand is on the handrail and the other one is on the straps of the bag to keep myself from falling. So always use the handrail. Even if you're not as old as I am, use the handrail just for safety's sake. Nobody wants to fall up or down the stairs. So just hold on to the handrail and do that little trick that I'm showing is instead of carrying something in your arms, put whatever you want to take up or downstairs in a bag, use the straps in one hand and the handrail in the other. And if you reach the point because of injury or some other reason you need to use a walker, use one and don't feel badly about it. Don't feel like, oh, I don't want to look old. No, just if you need the support, you should use it. And if you need stability from a walking stick or a cane, use it because you can make a statement by using a walking stick. Like this lady is, I think she looks kind of sophisticated with her pretty jacket and that walking stick. Now, the next thing I would want to talk about are saving your feet. You should wear shoes that are not too pointy, that have a reasonable sized heel, a sole underneath them that is not a platform. I remember when I was a young woman way back in the day, I wore platform sandals with an ankle strap, similar to what you're seeing over here in the black with the strap, that silver strap. I wore something just like that. I twisted my ankle wearing the thing. That was the last time I put on those shoes because I almost fell off the curb into the street. So that was my lesson. But this on the left hand side of the screen are the shoes that you're going to be safer in as you're walking. Lace up shoes or something that slips in. You can slip on that has the elastic gusset over here on the sides, and it'll keep your feet firm because you don't want to ruin your feet. You don't want to develop bunions and calluses and corns. You believe me, because then all you'll do is make your podiatrist rich while you're suffering walking in shoes. So wear shoes that fit you, that are comfortable, and that have reasonable heels on them. Now, my advice to you is protect your mental health. Don't allow yourself to get too lonely because people make serious mistakes when they're lonely. They trust people that maybe they shouldn't trust just because they are feeling lonely. So if you have a small circle of friends and you want more, uh, take the time to join an organization that has similar interests, like a stamp club, or you want to play bridge, or bird watching, or whatever it is. Just don't allow yourself to get too lonely. And if you begin to feel depressed, reach out to a counselor. Maybe your community has a counseling service that's on a sliding pay scale, or it's free to people that don't have the money to pay for it. Investigate, because there's no point in suffering through a problem when help is at hand. So be someone who is good for your own mental health. That's my advice to you. I'm really grateful for this opportunity to come here and share this information with you today, and I'd be really willing and happy to take some questions from you if you have any. I just want to mention again, please get screenings for your health. It's just really important. I mentioned a few things when we were doing the slides, but there are others that you can do in terms just to keep your finger on your body to see whether or not you are doing well. Take your blood pressure. As I mentioned, a mammogram. Check to see whether or not you have osteoporosis through a bone density test. Make sure that you don't have diabetes or not developing diabetes. Get the prostate cancer uh, examination, colorectal cancer, cervical cancer, Um, Cholesterol check, skin check, see if you have any skin cancer developing. Eye examination, I mentioned to you already, dental exams, both of those very important. Lung cancer, if you were ever a smoker, you should get your self checked to see if anything is developing in your lungs that you really need to know about. Um, we talked about just now depression, so get a mental health checkup if you feel like you need one. Um, so these are some of the screenings that you should involve yourself with on an annual basis or at least every 2 years. So at this particular point in time, I once again thank you for being such a great audience. If you have any questions, I'd be happy to take them. I'm going to stop sharing my screen now.
Well, thank you so much. Thank you so much, ma'am, from USA. We really appreciate you, ma'am. Thank you
Thank
so much for being the first to open our presentation or our section this morning. Bear in mind that this morning is a very, very special morning for every one of us. And it's Monday. Wow. Even though I'm blessed because I'm sitting down relaxing today, I'm not rushing anywhere because today is bank holiday here in United Kingdom, where we celebrate our children and also other things. So today is Children's Day. So we want to use this opportunity to express our gratitude to Ma'am Ambassador Jeannie Rapstad from USA. Thank you so much. May I also use this time to appreciate and acknowledge all our great leaders that has joined us here on this Zoom platform to start with Ambassador Sonatan Ghosh, the Director of English Center, and Professor Dr. Kavita GC, I'm getting it right now, and Coach Indiana Dewick Nofika. I also want to, because I know many people will still join us later, I also want to express my gratitude to Ambassador Rita Ilori, our Facebook coordinator. She has joined gracefully and she's been commenting a lot, ma'am, on your presentation. She's really going through. And also our dear friend from Georgia. I think we have one or two friends from Georgia. We also have Mr. Isaiah Kwangi. Thank you so much for joining us, sir. We also have so many people joining us. Let me see their name because it's good to let them know that we are together, either on Facebook or Zoom. We are live together and we need to appreciate that. Thank you so much, ma'am. I really appreciate you. Before ma'am goes off to sleep, because it's the either early in the morning around 2 o'clock from USA. Do we have any questions for her, please? Quickly. Question. Coach Ediana, do you have any questions for ma'am? Ambassador Sonatan, do you have any questions for ma'am? And Professor Dr. Kafita, do you have any questions for ma'am?
I think it was really great presentation, and she highlighted like, yes, we have to eat to live, not live to eat. That's really great. I love that point. Like I got logged out, but I was watching through the Facebook, so it's really great. Thank you so much, Sharon Jenny, for your presentation.
Thank you.
No
Thank
question,
you.
ma'am. Everything understood. You have discussed many important points. Thank you so much.
Thank
Thank you,
you.
ma'am.
Thank you. Thank you. Professor Kavita?
Yeah, thank you so much, Madam Jian. And I mean, it's been an amazing presentation, though I joined a little late, but I could see that it was pretty comprehensive in approach, talking about right from the holistic aspect of life, right from the food to the way you live to the way you stand. Because what I really liked in your presentation was the emphasis on what kind of footwear to wear, because we are standing most of the time, and it's so important to know, like, the kind of balance that we give to the body, and then the kind of the kind of the structure that we hold on, against the gravity, to have a proper posture. That's something I really loved in your presentation. And I also love the way you put across, you touched upon the things which are so trivial, otherwise, like nobody thinks about people look into the fashion statement of it, but they don't look into the health aspect of your daily aspect of living. Like, what do you wear and how do you wear and what kind of clothing, food, and everything. And I think the whole idea and insight into the presentation, I truly really liked it, and that was pretty informative and quite inspiring as well. Thank you so much for the wonderful presentation.
Right, amazing, amazing. Thank you
Thanks
so
for
much
kind
for
words. Yes, I appreciate the kind words very much. Thanks.
thank you so much. Thank you so much. And do you really recognize and love a cap? Hat, they call it hat, and a beautiful brazier with a very beautiful lipstick. I mean, this woman is close to 75, am I right?
Well, I'm going to be 76 in
Oh
September.
my God.
You look
Truly, truly
stylish,
inspiring. Yeah.
fantastic.
See, this is one of the things that, as we talked about in my talk. If you mistreat your body,
Hmm,
there's going to come a time when you have to pay the price.
yes.
Fortunately, I was wise when I was younger, and I didn't consume very much alcohol. And, I tried to eat well, and I stayed out of the sun because I'm a very light skinned person. And I used to get so sunburned when I was a child that I stayed out of the sun as an adult. And as a result, I've weathered the storms pretty well, and so that's the reason that I want everybody who were kind enough to listen to my presentation, that cause and effect is very strict. If you abuse your body, there's going to be a payday, and you probably aren't going to like it.
Hmm,
So that's what I want everybody to think about.
hmm. Mm. Thank you so much. Thank you so much. Okay, we need to move on now. But once again, we want to say thank you to Ma'am, Honorable Ambassador Jeannie Rapstad from USA for joining us this morning and also giving us a wealth, sharing with us a wealth of wisdom, knowledge, and experience. Anytime she joins us, it's like, wow, we are picking up a lot. Imagine a beautiful lady like this challenging us to take good care of ourselves. She's 76 already, as she said, and look at how she's looking, beautiful, glide, Spanish, or I mean, whatever words I can use, blessed, beautiful, everything. I really appreciate you, ma'am. Thank you so much for joining us today. Now we need to move on to our next speaker. And I'm in a dilemma. Coach Ediana is having problem with connectivity. So is it possible to quickly, because she's been off and on, the thing is knocking her out. Is it possible for us to allow her to be the next speaker? I'm asking humbly from Professor Kavita and Ambassador Sonatan Gosh.
Oh, sure, sure. Please go ahead. Yeah.
Yeah, because the system has knocked her down. We are watching it, and
Okay,
she have to do so many things to get back again. So we don't want to miss our wealth of wisdom and knowledge. So is that okay? Thank you. Thank you so much. Right. So let's go on. I'll close